On behalf of the Topsfield, Boxford, Middleton League of Women Voters, I would like to welcome you to this video voter guide. This guide covers candidates for election to the state senatorial seat in the 1st Essex and Middlesex district, which stretches from North Reading to Rockport, and for candidates for state representative in the 22nd Middlesex district, which includes Middleton, Wakefield, and part of Linfield. My name is Mary Jane Morrin, and I will represent the League as moderator for this presentation. The format will be as follows. Each candidate will have 1 minute to introduce themselves to you. Then, we will ask each of the candidates the same 6 questions. They will have 2 minutes to respond to each question. Finally, each candidate will have 2 minutes for closing remarks. First, we will hear from candidates for state senator. They are incumbent Republican Bruce Tarr of Gloucester and Democrat Klaus Kubierschky of North Reading.
Bruce Tarr, representing the 1st Essex and Middlesex District. I'm pleased to be with you tonight to be a part of this voter's guide produced by the League of Women Voters in the Tri-Town area. I've had the distinct honor and privilege of representing the 18 cities and towns of the 1st Essex and Middlesex for a very, very challenging time for the last year and 8 months. During that time, we've tried to address the most significant issues that have been facing the Commonwealth. First and foremost, trying to stimulate the economy with targeted tax cuts for the mutual fund industry and for the manufacturing industry. In addition, we've continued to look at the costs of Title V and septic treatment, trying to provide serious tax credits and low-interest dollars to help municipalities comply with costly state mandates. In addition, we've continued to look at crime, trying to close laws and the loopholes in the laws in telephone stalking, as well as looking at juvenile justice, trying to make a difference in the issues of crime that are so serious to our neighborhoods. All in all, we've had a very productive year and 8 months, and I'm with you tonight to ask to be returned for another 2 years to work with you on these topics.
Hi, my name is Klaus Kubierschky. I'm the Democratic candidate for the state Senate. I live in North Reading. I've lived there for the past 31 years. I'm married. I have 3 grown children and 5 grandchildren. And I was born in Germany in 1933, and I grew up in Italy. And I've lived in the United States since 1951, and in Massachusetts since 1952. And I became a United States citizen in 1957. I've attended MIT and have a degree from there in electrical engineering. I served 2 years in the United States Army. And I'm an engineer and a manager at Hologic, a small high-tech firm in Waltham, Massachusetts. I've been involved in my local community of North Reading. I've served on the Board of Public Works and on the Board of Selectmen, and I've been the town moderator for the past 12 years.
The first question is, what measures would you support to help local communities facing increased municipal and educational costs?
First of all, I think it's important to remember that the most important jobs done by government in many respects are done by local government. That's why I've been proud to be a supporter and will continue to be a supporter of early local aid resolutions that will let cities and towns know what they can expect for revenue. But in addition to that, we have to work on increasing revenue for our cities and towns. That's why this year's budget was so significant in growing revenues from municipalities faster than nearly any other account. I support continuing that trend by continuing to return lottery dollars, continuing to look at other avenues to return dollars to cities and towns, such as Chapter 90 for our roads and bridges. Again, critical components. In addition, I've been a proud supporter and will continue to be a supporter of zero-interest funding for water and sewer projects, trying to continue our work for the School Building Assistance Program, and trying to look at the costly mandates of special education. But that's important because it's not only a situation of increasing revenue. If we're going to help cities and towns, we have to cut costs as well. And that's why I've been pleased to look at those municipal mandates and continue to try to cut them or change them, specifically in terms of Title V, special education, looking at other areas such as the Northeast Solid Waste Committee, trying to reduce costs to the cities and towns by providing $22 million in bonded assistance. We haven't gotten that money yet, but we need to continue to work to do so. Last but not least, we need to continue to look at municipal borrowing. In an era when municipalities are borrowing more and more because of increased enrollments and necessary building projects, we need to change the municipal finance laws to make them more cost-effective for our cities and towns. I've been pleased this year to make progress in increasing the allowable period of time for short-term borrowing from 2 to 5 years, thus cutting interest rates for cities and towns. We need to continue to look at the municipal finance laws and make sure that when a necessary project gets undertaken, we help every step of the way with a regulatory framework that makes the borrowing as least costly as possible.
In 1978, the people of Massachusetts adopted Proposition 2.5 by a very substantial margin. The intent of at least some of the people who favored Proposition 2.5 was to have the state pick up the costs that previously had been paid by local government. This worked, at least in the beginning, for a while. The state economy was strong, and under the Dukakis administration there was a lot of revenue sharing from the state to the cities and towns, and the cities and towns were able to get along very nicely under Proposition 2.5. But when the state economy turned down, things changed. And tax revenues came down when there were fewer jobs and fewer people receiving income to pay. And the state, both the executive and the legislature, decided that they did not want to part with the revenues that they had, and that's when the problems for the cities and towns started. To get out of this pickle, we need to strengthen the state economy so that the state will have sufficient revenues to share with the cities and towns. And we don't just need to do it once. We need to try to do it in such a way that the state economy will not be of such a cyclic nature, going from boom to bust all the time. We want to keep it at a steady level. And if we are able to succeed in doing that, then the state will be able to support the cities and towns, and we will all be better off.
The second question is, should Massachusetts expand health care to residents who are currently uninsured? If not, why not? And if so, how?
Massachusetts has certainly tried to increase health care to folks who don't have it presently. The reason for that is, first of all, the public safety, which is a compelling state interest, but second of all, because folks who are outside the system simply present too often at our acute care hospitals and driving the cost up of the aggregate cost of health care. How can we do that? This year we made significant progress on 2 bills that I was intimately involved with. First of all, trying to increase access through a bill that increased the cigarette tax, although I think there was a better way to fund it. But we did try to increase funding, and we did. First of all, to increase the Children's Medical Security Plan, making it available for kids up to 18 years of age. And secondly, trying to provide premium subsidies for prescriptions for those among us who are senior citizens. That was a good first step. It was followed by a second step of a non-group reform bill trying to make insurance affordable for those who can't get into a group and can't afford non-group premiums. We did that as well by creating standardized plans, guaranteed issue, portability, and we even took the extraordinary step, which I've been advocating for a number of years, of standardizing our billing system to allow doctors to give health care and not do paperwork. We've got a long way to go. We need to continue to look at the folks who are working poor, who need insurance but just can't make ends meet. We can do that through employer subsidies and employer tax credits to help incentivize employers of small businesses to get insurance for their employees. In addition, we could give subsidies to employees to encourage them to buy insurance and be part of the system. Even further than that, for those who simply can't afford it, we can continue to look at expanding our Medicaid system to allow folks to buy in on a sliding scale basis. That would allow folks of all income ranges to have the benefit of the Medicaid program while still helping to make it significantly more solvent financially. There's a whole spectrum of tools that we can use, and we should use them aggressively, trying to preserve our market system of health care, which has driven so many medical advances, but also trying to make that good quality care available as preventative medicine and not acute care medicine.
This is the kind of an issue that very often gets resolved in the small hours of the morning by a sleepy group of legislators, and I don't think that this is the way this one should go. I think that we should have some way of providing health care for all the people in the Commonwealth. We are providing for most of them right now, either through the welfare budget or through some form of charity or other. I think that if we organize it in such a way that people know how to go about getting health care and are entitled to at least basic health care, this will work out much better to everybody's satisfaction. Now, I think that we should provide health care through a voucher system where the state pays for providers who are currently providing that service. And it should be paid on a basis where the vouchers are reported to the State Department of Revenue, and the State of Revenue keeps book on everybody who receives free health care from the state. And that book is then compared at the end of the year to the income of those individuals who receive it. And if their income is in excess of a certain minimum, then they should reimburse the state for the expenditures up to a maximum which is somewhat higher than 100%, so that if they have a good income, they pay more than the state paid out for them.
The third question is, please state your views on banning assault weapons.
Assault weapons are generally defined by folks who understand firearms as firearms that can be automatically fired at the will of the user. And in fact, since 1934 in the United States, federal regulations have made those weapons very difficult to obtain, with few exceptions, those being folks who are specially licensed by the federal government. In addition to that, the Violent Crime Control and Law Enforcement Act of 1994 banned the manufacture of over 19 assault weapons and look-alike weapons that could be similarly treated and modified to become fully automatic. Those laws are in place and they're beginning to go to work. In fact, since 1934, one of them has been in effect. And since 1995, I believe, Boston, could have been earlier than that, has had an assault weapons ban which has had little additional impact. That's why I think that we should concentrate on putting those in jail who are going to use firearms in the commission of a crime. That's why I've been a consistent supporter for my entire time in the legislature of making it an additional crime to use a firearm in the commission of a crime. I also very strongly support stiffening the penalties for felons in possession of firearms. These are people who would threaten our society, violating the laws and using firearms as the instrumentality of the threat. We need to continue to work toward eliminating that kind of a threat, and we also need to look at an additional aspect. We read far too often in the newspaper, hear on the radio, or see on television stories of children killed by the misuse of firearms in the home. That's why I think we need to continue to look at the adaptation of laws that would require the use of trigger locks, proper storage, and education so that our kids don't find themselves the innocent victims of a firearms accident. Coupled with putting criminals in jail, I think we can go a long way toward curbing domestic violence, violence with guns, and violence with drugs by looking at those who commit the crime and being serious about that, being serious in our communities about helping our kids. I think those will go a long way toward complementing what's already in effect.
When I was a kid, I always wanted to have a gun. My parents were smart and they didn't let me have one. I have a pretty good idea why the people who are in the National Rifle Association and who are fighting weapons bans as hard as they do want to have their guns. And I think that the rest of us should be wise enough that we shouldn't let them have their guns, just like my parents didn't let me have my guns when I was a child. Just think of it. If there's a burglar in your house at the other side of your living room, in order for that gun in your hand to do any good, that burglar has to think that you're crazy enough to use that gun on him. Would you trust somebody who's crazy enough to use a gun on a human being with a gun? I wouldn't.
The fourth question is, do you think judges should be allowed to consider evidence of spousal